Hi, I'm Dr. Raj Sundar, a family physician and a community organizer. You're listening to Healthcare for Humans, the show dedicated to educating you on how to care for culturally diverse communities so you can be a better healer. This is about everything that you wish you knew to really care for the person in front of you, not just a body system. Let's learn together. Welcome back to part 2 of our series on female genital mutilation and cutting. Last time in our episode with Isa 2, we heard a powerful story from a survivor of FGM who helped us understand the deep personal impact of this practice. Today, we're going to shift our focus to explore what meaningful change looks like, especially at the community level. When we talk about ending harmful practices like FGM, the task often feels overwhelming, or at least it does to me, thinking of how big this change is and what I'm supposed to do as a clinician in the places that I work. Because we're looking at centuries of tradition and really do wonder, how can we make a difference? 2 critical things have shaped my understanding of both this work and answering that question. First, as healthcare providers, we often feel pressure to solve societal issues in our exam rooms. In our last episode, we discussed how trauma-informed care is essential in building trust with survivors. While these one-on-one conversations matter deeply, lasting change requires a broader approach. It means supporting organizations doing grassroots work, amplifying community voices, and recognizing that progress happens through many channels. So it's not just on you. It requires a lot more people and a lot of conversations and deep advocacy through communities and community organizations. Second, researchers have discovered something remarkable. How when 25% of a community abandons a harmful social norm, the rest follow. That's 1 in 4 people. When this threshold is reached, communities transform rapidly. This shows that change is possible, even with deeply rooted practices like FGM. In today's episode, you'll hear from Samman from Sahiyo, an organization that exemplifies community-led change. Founded in 2015, Sahiyo works to advocate for girls' and women's rights and oppose FGM in Asian communities. Their founding story challenges the common misconception that I've talked about before, that FGM exists only in certain regions or cultures. This is important work for everybody. Through their work, they demonstrate how sustainable change emerges from within communities themselves. Let's begin. Hi, Samman. Welcome to the podcast.
Hi, Raj. How are you?
I'm good. Before we get started, tell me about yourself.
I'm Samman, and I am the Community Engagement Coordinator at Sahiyo. And we are an organization which began early 2015. It began as a conversation between 5 women who felt strongly about the ritual of female genital cutting in the Bora community, which is a sectarian group within the South Asian community. This group included a social worker, a researcher, 2 filmmakers, and a journalist. Each individual had been openly speaking out against the practice of FGMC, and I do advocacy work here and just looking at ways to end the practice through storytelling, policy work, community education, and so forth.
Yeah, it's very important work. Maybe for me, but also as I keep talking about it, I want to make sure I use the right language. This can be a whole conversation itself about female genital mutilation, female genital cutting, circumcisions. I think you've talked about it in webinars before, but what do you name it? Because there's perspectives on what to call it from different people.
For our conversation, we can refer it to as FGMC, so FGM/C, which is what Sahiyo uses. Usually in our work, the most commonly associated terminology used is FGM, so female genital mutilation. Mm-hmm. Many activists working to end the practice have chosen to use this term, the female genital mutilation, believing that, this is the one term that correctly identifies the harm that is being done to a girl's genitalia. But at the same time, there are varied reactions to the term mutilation because it can have a stigmatizing effect, while others may embrace it as a reflection of their experience and choose to say mutilation. And we also note that there have been studies that reveal that the term mutilation can have traumatizing effect on survivors who are living with it. At the same time, Sahiyo is a community-led and survivor-led organization. So Our goal here isn't to alienate the communities we work with because FGC is what most commonly resonates with the South Asian Bora community and individuals we work with. So none of these terms are incorrect. They all refer to the same practice. When we work with community members here at Sahiyo, we use the terminology that they refer to in their practice. If someone uses the term katna, which is like a colloquial term within the South Asian community, we use katna. If someone uses the term female genital mutilation, we use mutilation. The critical bit is dialogue is key to addressing FGMC and ending the practice in communities. It's only possible when communities are willing to engage with us. And for that, we have found that language is important. So best practices to use the same terminology that the individual or communities that we're working with are using it. Here, for our purpose, we can refer to it as FGMC.
Yeah, that's very helpful to reorient yourself into thinking about the impact that you want to make and saying, this is what the community names it. Let's name it that to have the conversation. Because if you don't call it the same thing, I think, as you noted, there's stigma, there's all kinds of conflict you're already starting on the practice itself before having the conversation. You mentioned that it started in the South Asian community. Sometimes with FGMC, it seems like it's something that's happening somewhere else to somebody else, especially when you're in the United States and feeling, oh, I grew up here. It's not something that happens here. I think that's actually a mistake and incorrect understanding. Could you tell me a little bit about what the data shows about FGMC in the United States as well as in North America, or maybe countries just what people don't, quote unquote, typically think of?
Correct. That is the most commonly held misconception, if you will. The Center for Disease Control and Prevention's Division of Reproductive Health estimate that about 500,000 girls and women in the U.S. have undergone FGMC in the past or are at risk of undergoing it in the future. Leister in the UK, and he has been researching female genital mutilation or cutting trends in the US with the support of AHA Foundation, which is the Ayan Harsieli Foundation, and works on women and gender issues in the US. His study found that an estimated 570,000 women and girls were impacted by FGMC between the period of 2015 and 2019. So this estimate did take into account migration and acculturation. So even if we're looking at it conservatively, this data reveals that 380,000 women and girls were living in FGMC in 2019. And more were at risk. Obviously, immigration patterns continue to impact this number. And with diaspora communities growing in the US, it's only supposed to go higher. So contrary to popular belief about FGMC, that it's something that's practiced in part of the global South, it's inaccurate. We also have cases of FGMC that have been reported in white fundamentalist Christian communities. It's not an anomaly in the US.
Yeah, I think that's important to call out, both that because of the changing demographics, as well as it does happen in even white fundamentalist cultures, because that's one of the stories I think I saw in your webinar that I've seen in a few webinars.
Yeah.
FGMC, when it happens in certain communities, they often have a justification behind it. And there's a whole list of justifications, which includes anything from religion to this is just how we do it. But part of Sahiyo's work is framing it as a social norm to help us better understand its persistence. Could you tell me about that specific framing rather than going into, oh, it's not religious, let's not talk about that, and trying to combat that perception? You could, I think, spend a lot of time combating perceptions of why it's there, but it's ever evolving and shifting from my understanding.
So I think that here we try to frame FGMC as a social norm. I think it has helped us highlight the collective nature of the practice. So helping to address it just not through something that individuals do, but there are broader systemic pressures that sustain this practice. So in doing so, it helps us to avoid stigmatize individuals or communities that religions practice it, and there's a constant back and forth about it. I think that once we shift the focus to societal change and as a social norm, then we're able to address it fully. Relatedly, we also know from research that if 25% of a community abandons a harmful social norm, the rest are likely to follow. There are studies that reveal it takes incremental change to reach that mark, but once that tipping point is reached, communities abandon that practice. So I think that just putting this on norm prevents us from engaging in other factors. While they're always contributing to a cause, they're not sufficient to provide justification of why a practice continues. It's a whole host of issues. But once we put the focus on social norm, I think it just makes the work a little bit more easier, if you will.
Yeah, that makes sense to me too. So many behaviors that communities have are social norms. It doesn't just have to be FGMC. I think just
Right.
part of the culture of the community. I want to talk about next on what do we do for communities that are experiencing FGMC and from different perspectives. Part of this podcast is oriented towards clinical professionals. So part of this conversation is about how do you have a conversation with someone who has experienced FGMC? That's one. The second part of it is preventing at a community level, which is what you all are focused on. I would love to hear about that.
At Sahiyo, we've talked about putting the stress on language when talking to these communities or survivors or people who may be at risk. So really establishing trust would be is our first goal when we talk about training medical professionals and providers. On a more specific level, we can talk about what works best for the patient here in question. Once that's established, I think providers need training on cultural humility and trauma-informed care, which goes beyond just medical knowledge and really taking into account patient bedside manners. Through this, they can play a role in empowering patients by taking the time to educate patients and making informed decisions when they're engaging with them. Really, I think the focus of Sahiyo in educating communities or stakeholders, which involve institutions and healthcare providers, is providing comprehensive lessons and training on what FGMC is and the different types is critical. So currently, our systems and guidelines lack depth and practical tools for addressing FGMC with cultural humility. So understand that FGMC is practiced within different cultures or diaspora communities for different reasons. Currently, we don't have a standardized medical school curriculum, physical or psychological or psychosocial or cultural social norm education. We really need to involve trauma-informed care and teach and reinforce trauma-informed care and look at what all the steps are in providing care to patients who are survivors of trauma. Recognizing that trauma might be a factor in a patient's life is critical. So it's just a very generic guideline to how to treat FGMC patients or survivors. I think it lacks nuance, and maybe we might have more trainings and guidelines that look at it comprehensively and taking into account culture sensitivities and gender sensitivities, treating them with respect, introducing other mechanisms of support like peer support. We've found over and over that patients can benefit from hearing stories from other survivors of FGMC and what strategies they use to cope with their symptoms and whether they're physical or emotional. So there, in addition to trust and transparency in a great provider and patient relationship, there are specific culturally sensitive guidelines that we can incorporate in pamphlets or educational material when we're discussing female genital cutting with patients.
Yeah. So the part of this work is understanding the cultural nuance. I know you use the word humility, which we focus on a lot in the podcast too, but FGMC means something different for specific communities, and it's important to understand that context to know what to do
Right.
next. One follow-up question on what does trauma-informed care mean to you in this setting?
Sure. Trauma-informed care is a recognition of trauma symptoms and being equipped with the right kind of support systems, ensuring that the patients are physically and emotionally safe in an environment where they're being treated, ensure that there is a level of trust and transparency established for a great provider and patient relationship. We have mechanisms of support, ensuring that there are cultural nuances and sensitivities that are taken into account when we're addressing survivors of FGMC, ensuring that we're not alienating the communities we're trying to take care of. For example, if we have a patient or a survivor of who has undergone cutting, we have to be critical about ensuring that we're not engaging with them about issues that might be triggering. This might be a practice that some communities say is rooted in religion. And although we found over and over that's not the case, it's a discussion point that keeps coming up. These kind of bits are helpful in educating provider communities, healthcare communities, and just working better with survivors.
Yeah, that really does make sense. And for partly my curiosity, but I think will be helpful for others to understand, how do you respond when people bring up the religion, saying you're in a community because you do so much work around this, and they're talking about FGMC and they said, oh, this is our religious belief. And you inside know that that's been conflicting about religion being the source of it. It's probably something else. How do you respond to that without maybe encouraging that belief?
I think the goal, because I know that this is a recurring theme in conversations when we talk about FGMC or other practices of gender-based violence where culture or religion is invoked, I'd say always learn to not engage in arguments, if you will. So our goal is always to shift the conversation into a dialogue as opposed to engaging in a conversation where there's a back and forth, because that is not conducive to a healthy conversation. Does that answer your question?
Yeah, I think it happens
Right.
probably in provider visits too, where somebody said, oh, it's just my religion. That's what happened to me. I'm going to do it to my daughter. And then you're stuck in this conversation. Like, I don't know if it is, but you don't want to say that. So now you're in the space on like, how do I maybe redirect, or where do I take this conversation?
I think there's literature out there that obviously debunks the religious myth, but people who practice it or communities where it's practiced reinforce the religious aspect. What we have found has worked is disengaging from a conversation where religion is and just centering the conversation on women's health, because we've seen in the past that discourses around women's rights and human rights are not sufficient. But when it becomes an issue of a public health crisis, I think that takes precedence over all other. We found that to be most helpful when we're confronted with this dilemma.
Yeah, that makes sense. The other part that I wanted to follow up on was, I think you mentioned the treatment was peer support. It's helpful for a lot of gender-based violence, but a lot of healthcare issues that we try to address in a provider-patient relationship or clinician-patient relationship, that should be peer support. Other than peer support, are there anything else that you found are helpful for people who've experienced FGMC as interventions to heal through this trauma they've experienced or this body they're living with and maybe continue to have symptoms with?
I have found that in addition to peer support, networks are very critical. Incorporating storytelling and combining it with advocacy and educational initiatives to help survivors has been very successful in helping survivors, because through networks, they're able to find community. The advent of social media and digital media and the internet has allowed us to gather or organize in unconventional spaces. So just storytelling and digital workshops where survivors can connect with one another has helped them a lot. We have also found in our work that private advocacy and private activism is so helpful. While we find that there's a lot of activists out there who are so vocal about it, at the same time, there's a large cohort of folks who are not comfortable talking about it very publicly. Mission and sales work has allowed people to remain anonymous and publish blogs and talk about their stories of survival after FGMC and living with post-traumatic stress disorder, which is very common and found within people who've experienced it. And I think that network is very critical to the survival of communities who are coping with FGMC.
Yeah. We found any body-based work to be helpful, because a leader in the Somali community who was using some body-based work, because there was some yoga involved, there's other mindfulness practices involved, because it was such a physical experience and people have trouble talking about it sometimes. Outside of storytelling and sharing publicly, there was just acknowledgement that this is a kind of healing that's helpful for the community as well.
We have seen that in practice. There are physical interventions that have helped people. We've done webinars in the past with gynecologists, and I believe that there are practitioners who engage with specific yoga practices that involve the lower body for women who have experienced FGMC to engage with it in a way that is helpful. There are practitioners out there who've talked about this and who teach interventions in the lower body and how to engage it through mechanisms of yoga and therapy.
I think it's just worth calling out because there's diversity of ways to approach healing when people have experienced FGMC.
Right.
The next section I wanted to talk about was about the prevention and community engagement, which is also another thing that you all focus on. I think you called out some of the interventions you have, which is storytelling, community engagement. For preventing FGMC, how do you help communities be empowered to lead these prevention efforts? How do you strategize on bringing this conversation up and helping communities feel empowered, and then transition to somehow preventing future generations from FGMC?
Community education, just public awareness is key, right? Comprehensive education on the topic is critical. I am somebody who comes from a background in women and gender rights. I'm a generalist in that area, but I hadn't specifically engaged with FGMC as an advocate before joining Sahiyo. At Sahiyo, I got the chance to really delve into it because the way Sahiyo engages with the work. FGC 101 is how we approach it to communities who have not previously studied it or come across the topic at all. Our goal is to just really instill in communities a great foundational learning of, FGC, what it is, dispelling the myths about educating people that this is a grave level of public health crisis and needs adequate response from community members and stakeholders, whether it's the government, nonprofit organizations, women's rights organizations, public healthcare providers. So that is our first goal in ensuring that if there's a community that does not know about it, we lay bare the foundation of what it is and what it's not. Yeah.
So first part is community education. How do you balance the legal enforcement with community engagement? Let's say in the United States, it's illegal, but you find that a community is doing it. How often do you bring that up, or when do you turn towards it to make change?
Legal enforcement is important, obviously, but it's not sufficient alone. It has to be paired with educational outreach. We have seen in some countries where legislation has pushed the practice underground. People feel targeted, they're stigmatized. In the case of, let's say, Somalia, despite the practice being illegal, the rates of FGMC haven't gone down. We've seen that in other countries as well. In states where it is illegal, the practice is then taken out of the country. So vacation cutting, where a parent, guardian, caretaker will take the child outside of the U.S. and have it performed in their countries where the laws aren't so robust.
So it's necessary but not sufficient because there's ways to get past it because legal is not enough because it's such a societal norm, as you're noting.
Effective enforcement, I think it respects cultural context. It recognizes everyone's experience with FGMC is different. We recognize that FGMC, although it's harmful, has grave consequences for the person involved. It's not always or not necessarily performed with the intention to cause harm because of the way the practice is rooted in society. If it respects cultural context, I think that we can lead to better outcomes.
You're already using technology and methods that are probably inclusive younger generations, like storytelling and the videos that you all are so excellently making. How do you feel like younger generations are approaching these issues differently?
I think younger generations, it's safe to say that they have leverage in this conversation. A lot of the times, younger generations are in academic institutions. They have access to resources, research, and literature that can provide them with a comprehensive understanding of the issue. They can easily counter misinformation about FGMC that it's rooted in religion or culture, which is not the case. So we just had a webinar on youth advocacy, and we were joined by several young advocates who spoke at length about their experiences of addressing the topic of FGMC. One panelist has stressed the role of intergenerational engagement, noting how each generation can push boundaries and contribute to the movement. Other activists talked about the importance of engaging with older generations who are often more resistant to change, which is crucial for the movement's success. And obviously, with the advent of social media, younger generations have more leverage in terms of social media advocacy or digital platforms and leveraging cool new tools to do the advocacy work. So they're like exciting digital campaigns on human rights violations, these small snippet videos that allow people to learn about a topic really quickly. And sometimes that's not sufficient, but it's also very helpful if it's done creatively and if it's done well. So youth advocacy combined with social media activism on digital platforms allows people to mobilize groups across transnational borders on an issue that impacts various communities. So it has the potential to reach a global audience. Younger audiences also have in the past and continue to engage members of societies that otherwise are not traditionally engaged with FGMC in their typical environment. So Sahiyo has a male engagement program where men within the South Asian community, and also we've seen in other African communities, FGMC is relegated as a women's only issue. But social media has allowed people to form relationships with male identifying members of society who want to talk about the issue but haven't previously felt comfortable enough. So I think that internet and youth advocacy and new forms of organizing online are all very helpful in mobilizing a large group of people we haven't seen in the past. And I hope that it is successful. And we're seeing those trends online and people talking about it more so than ever before.
Yeah, it requires a ecosystem of interventions to change something so pervasive and historically rooted and culturally stable. Regarding policy, we talked about community level interventions or prevention a bit. What policy levers are you all working on or think about to end FGMC?
So ensuring that FGMC is illegal in the states where it isn't yet. Currently, there are several states where it isn't considered illegal. So that is critical. Even if a law is in place, I think that if there isn't widespread effort to educate the public on the consequences of FGMC or any new legal provisions, communities may remain unaware or ignore the law. The success of anti-FGMC legislation depends on its integration into broader efforts, which includes improving women's rights education and healthcare and community empowerment. Really just integrating education and combining it with public awareness about the laws that are in place and if impacted that people would be punished or parents, caregivers who are harming their children with this practice, that there will be consequences for these actions.
I'm from Washington State. I think you were quite involved in doing that work in Washington State. And part of that work also included education to the constituents about what it is, because people had to vote for certain bills to make sure that what you're imagining is passed. At the core of making change is to include the voice of survivors. And I think you've had that in every place that you've gone. And how do you amplify the voice of survivors that want to share their stories? Because that's an intentional based work, because you have to have somebody who's willing to share and who feels empowered to make change in that way and engage communities that way.
So we have the activist retreat program. In addition to the storytelling program, Voices to End FGMC, it's such an amazing program where we work with storytellers, survivors, and advocates of FGMC to come together and join this critical mass of folks who want to talk about their experience with the practice and how they are overcoming it, the physical and the psychosocial impacts, the mental health impacts of FGMC. So that's a great program, and it continues to grow. We are coming up with a release of the latest Voices cohort shortly, and I think that you will have a great time watching their videos that are about to launch soon. I would say just to be on the lookout for that. The other program here at Sahiyo that we have is the Activist Retreat Program. It is a retreat program that was organized in the U.S. for the first time in 2018 for advocates who were working to end the practice. The retreat aims to bring together advocates or survivors who are speaking against FGC, whether they speak publicly or anonymously, to raise community awareness about the need to end this. This retreat takes place annually. Traditionally at Sahiyo, it's been for South Asian communities where FGMC is practiced. But this first time this year, we had a virtual retreat and it was open to other communities outside of South Asian Bora communities. So we had a great cohort of survivors and advocates who came from different diaspora communities in the US where FGMC is practiced, and talked about what the conversations around FGMC, what they are doing and what methods and strategies and mechanisms they're employing to end it, and what we need to do to collectively work to end this practice.
Let's do a quick wrap up. Samman, how can we best support you and the work that you all are doing? Where can people find you all, and what does support look like?
Sure. So you can find us on sahiyo.org and look at our programs. We do extensive community outreach work. We have an excellent Storytelling Voices to End FGMC program. I think that the best way is to mobilize with us, publicize our work. We can be found on LinkedIn. We have a Facebook page and Instagram page. Follow us there and look for exciting programs and developments that are happening at Sahiyo. We continue to engage with exciting stakeholders in the non-governmental and also the governmental space when we attend these collaboration and collaborative meetings. There's a lot of interesting announcements that we make about the work that we want to do in the future.
Awesome. Thank you so much for doing this. Very informative, but also important work. And hopefully more people can join after hearing this. Thank you.
Thanks so much.
As always, thank you for listening to Healthcare for Humans. If you've found any value in this podcast, I have 2 quick requests. 1, please leave a review in the podcast app that you're listening to my voice in right now. It really helps others discover the show. 2, share this episode with anyone who you think might benefit from it. For easy access to all our episodes and to support the podcast, visit www.healthcareforhumans.org. There you'll find our content clearly organized, topics, countries, themes, to help you choose what to listen to next. Until next time, this is Dr. Raj Sundar, reminding you that culturally responsive care leads to better patient outcomes. See you again soon.